Hello friends, I'm Dr. Shunetra. I'm a pediatrician and today I'm going to discuss about one of the most common but very confusing topic, that is the combination of the composite vaccines. So these vaccines are actually components of various vaccines clubbed together to form a single vaccine component. For example, pentavalent and the hexavalent vaccine. The main advantage of these vaccines is that instead of multiple pricks to the child, all these vaccines combined into one single vaccine, leading to lesser number of pricks to the child. So in pentavalent vaccine is a 5-in-1 vaccine consisting of components like diphtheria, pertussis, tetanus, hepatitis B and Haemophilus influenzae type B. Similarly, hexavalent vaccines consist of components of DTP, injectable polio, Haemophilus influenzae type B, and hepatitis B combinations. If we look into the immunization schedule, we can see that at 6, 10, and 14 weeks, we have the vaccines like DTP, Hib, IPV, and hepatitis B. So these 6 vaccines can be combined together into one single vaccine, that is the hexavalent vaccine. Again, at 16 to 18 months, we see that we have DTP, Hib, and IPV vaccines which can be combined to form a pentavalent vaccine. If we look into the immunization schedule at 6, 10, and 14 weeks, we have oral polio vaccine and the pentavalent vaccine. So here also they have incorporated pentavalent vaccine and oral polio vaccine. If we want to go deep into this, then we can say that oral polio vaccine is less effective when there is high force of transmission, and to improve its efficacy, repeated doses of OPV is required. And being a live vaccine, though there is a minimal risk, but still there is some risk of vaccine-induced polio. That is why injectable polio vaccine has come. The advantages being it is completely safe and it has high efficacy and it can be combined together with other vaccines like DTP vaccine. The only disadvantage is that it is very costly vaccine. That is why in national immunization schedule they have not taken IPV into the schedule. Still giving pentavalent and the OPV. In some places they are only giving fractionated IPV in a smaller dose. Coming to the next important topic as to painless versus painful vaccines. Painless vaccines are actually less painful vaccines and painful vaccines are actually the normal vaccines. If we go more into this topic, we'll find that DTWP, which is the normal vaccine or the so-called painful vaccine, because when it is given to the child, it will cause swelling, redness, inflammation and pain at the site of injection. The reason being is that it contains the whole cell component of the pertussis, which is used as antigenic, and this makes it highly immunogenic but more painful. Whereas DTAP, which is known as painless vaccine, which is actually the less painful vaccine because it uses components of pertussis bacteria as its antigenic components. This is the reason why it causes minimal or very low reactions like pain, inflammation, redness. Though it is considered less immunogenic than DTWP vaccine, but still it causes enough immunogenicity to give protection to the children, and that is why it can be regularly used instead of the normal or the painful vaccines. Here are some examples of the pentavalent and the hexavalent vaccines. This video is not a sponsored video and these examples are very common brands which are available in India as the pentavalent and the hexavalent vaccines. So these are examples of the normal or the painful vaccines, and here are some examples of the painless or the less painful vaccines. And these are the packaging and the vaccine pictures. One important point to discuss is that if someone wants to schedule their child's vaccine, they should consult their pediatrician or the concerned hospital. This video is just for information and better understanding, and not to decide on which vaccine a child should receive, for which they should consult the concerned pediatrician. So friends, if you like this video, please share this video, hit the like button and subscribe to my channel. Thank you.